Hi everyone, we're the neuro-oncology CNSs here at King's College Hospital. Today is actually GBM Awareness Day. So what we wanted to do was to make a video to help push the awareness in this extremely rare tumour group. We know that cancer funding is only about 2% of the cancer diagnosis of a brain tumour. So what we wanted to do today is just kind of have a chat to push this awareness today. So I think one of the topics we thought about at first was some of the most common presenting symptoms that we see for patients, because for a GBM, it is an acute presentation, meaning it's a sudden onset. I think what we normally see is they present in A&E, or they've told us that they've gone to their GP multiple times and then it's ended up going to A&E.
And patients often find it quite frustrating because they feel that they've been not very well for a long time. They've had funny symptoms, they've had headaches, they felt sick, and they've been telling people over and over that they don't feel right. But actually, all of a sudden, then they have a big event such as a seizure or a really bad headache, which sends them to A&E. And I think we feel a lot of their frustration that they try to speak to people and they don't know what to say. And they don't know how. So we try, in terms of awareness, if anyone's feeling that way, we'd just encourage you to keep going to your clinician. You know your body better than anybody else, and say that you don't feel right.
Yeah, well, I'd say no, I was just going to say what I would say is very interesting is that no two stories of presentation are the same, very, very different. You can have kind of an onset of symptoms over sort of 2-3 months, very odd, peculiar word finding difficulties, or notice that I couldn't type with one of my hands as well as I have been able to. Really very niche symptoms that you wouldn't think about, and actually on reflection it's been going on for longer. And then something will happen to take you to a doctor or A&E. So I just, I think that's worth saying as well, just for people watching this, that it's not something that, is a textbook presentation for this type of tumour.
Yeah, agreed. And I think that that's one of the things, isn't it, that a lot of people say to us, oh, I haven't even had a headache. And so some people will have the crushing headaches, but there'll also be the people who think, well, I must have had a headache for, to have a brain tumour. And that's one of the things the Brain Tumour Charity have launched their early diagnosis, early detection campaign on. And so we'll include some information for you, but they're also doing quite a lot to raise awareness. We know that the treatment options aren't extensive. We know that the recurrence rate is very high, and we don't know when it will be exactly for you, but we know that it's unfortunately something that will be there looming, and it's what can we do about it when that happens. And we know, Charlotte, I think we have quite a few people, don't we, who talk to us about what else they can do, because they don't want to just sit and wait for this to recur.
Yeah, exactly. So lots of people decide that they wish to seek alternative routes to go alongside their conventional treatment, and we'll always be very open to suggestions. And people will frequently send us newspaper articles asking about a new treatment that's been in the press, and of course we are very happy to entertain the idea and to advise on it. I think the important thing is that anything we would really recommend that we do it alongside conventional treatment, because alternative therapies, they don't have the evidence base at this point, which is why we can't say for definite that it's going to help, which makes it tricky.
The clinical trials that we're doing are trying to do exactly that, aren't they? They're trying to say what can help and what can't help, and we know it's really disappointing when we have a trial and the results aren't what anybody would have hoped. But one of the emerging areas, which is exciting in terms of looking at treatment options, is also the impact of genomics, Erin, isn't it? And how we're learning a little bit more about the tumours themselves.
Yeah, that's right. That's really very, very new in our field now, that looking into the entire kind of sequence of, the tumor genomics basically, and, and what what kind of variation or genetic variation that caused you of having a tumor. We're in a very early stage, but we're hopefully going to find some more kind of information and course about this. That's why we're enrolling people to like our phases of studies. At the moment, we're only dealing with peds and ages 25 and below, but hopefully before the end of the year, will be open for everyone, and that would involve GBMs as well, to be able for us to at least get a more targeted treatment, to kind of like get more trials, to be able to kind of either, you know, to target it properly and be able to manage it accordingly.
Yeah, and that's all. I think what we all want to see is positive moves forward. And we know fundraising is a big part of making those things happen. We ourselves have been in part of fundraising, doing Tough Mudders, which we won't share the pictures of. And thankfully, hopefully there's no videos to be seen. But that was for the Brain Tumour Charity. And we know, Ellie, we hear, don't we, of lots of our patients doing really positive things to raise awareness and fundraise.
And also living life, like lots of our, if you Google glioblastoma or GBM, you get a lot of negative press about how serious this diagnosis is, and we absolutely know that this is a serious diagnosis, but people are still living life. They're going out, they're seeing their friends, they're going to Glastonbury Festival, they're going on holiday, and we support them to do all of those things. We feel your frustration when you feel that there's no movement going forward in the treatments. We've had the same treatment for a long time now, many years, but it is the gold standard worldwide. So the treatment that you would receive with us is the same that you would receive anywhere else in the country and anywhere else in the world as a first line treatment. But like we've said, we're very happy to explore all of the other options so that we can get you to live life as best you can with this diagnosis.
Absolutely, and that might be diet changes that you want to make, that might be some alternative options. We know there's lots of different things out there and things that are emerging all the time. We'd just like to be able to support people through it and to hear what you're thinking about doing so we can work alongside and work together. So ultimately what we're here doing for raising awareness and in our day-to-day jobs is we're here trying to make things better for you and as good as they possibly can be. So please talk to us or talk to the people that are looking after you and let them know what you're thinking or you're concerned or if there's something that you want to try and do.
Yeah, and I think we have what that then does is open up doors. So, you know, we have patients and families who have said to us, let us talk to people about this that we're doing or this that we've found out about. And I think that's really good for the community, just to get the communication going and start these conversations about different things or different experiences people have had. And I think the feedback that we've had from doing Brain Tumour Awareness Month from all these patients that we talked about in our videos was that, you know, life really does go on, and you have to, all of that stuff is really important to people, and that's what we want to be part of too. Some of the best emails we get in our inbox are about cakes and cats and marathons and other things. I can't think of anything else right now.
Playing in the orchestra, the family picture, the days
weddings.
Yeah, we love all of those.
I think it's also good to point out that the neuro-oncology in the UK is such a close-knit team that everyone knows everyone in terms of oncology-wise, surgeons and CNSs. And there have been changes in molecular markers findings in how much details and in-depth testing they're doing now, and that we're able to identify if there's a mutation that could possibly have targeted treatment. And because we're communicating with other teams who may have a trial drug somewhere else or a compassionate drug, where we are working really hard and cohesively to try and give a tailored treatment that we felt is suitable for you as well as the gold standard treatment, which is, you know, I think it's moving forward, even though it's small, tiny steps, it's steps that we're getting to make a change.
And hopefully we'll be here next year talking about the new exciting treatments which are part of our practice and the things that we're all pushing for. But our message today is that we all want to work together and we want to raise awareness and we want to let more people know about this very rare tumour type and to improve quality of life as well as the longevity of it. So thank you so much for listening to us all today and helping us raise awareness of glioblastomas. Thank you.